I recently found out that I have systemic lupus erythematosus. But what even is lupus? It's essentially when your immune system can't tell the difference between self and non-self, so it mistakenly attacks its own body. And unfortunately, it's not very picky. This form of lupus can affect any part of your body. So organs like your skin, brain, heart, lungs, or kidneys, but also things like your blood, nerves, bones, and joints are all at risk of being attacked. That nature is precisely what makes diagnosing this condition so difficult. There are so many symptoms a person with lupus may present with that mimic another disease. On average, it takes a person around 6 years to receive an official diagnosis. For me, it took just under 3 years. Looking into the mirror one day, I saw that I had these visible lumps on the left side of my neck. They looked to me like swollen lymph nodes, and I had no idea if it had been that way for a while or if it had just popped up. I decided I'd wait a while to see if it would go away, and if not, then I'd go see a doctor about it. Around 3 months later, they were the exact same, so I went and saw a primary care doctor. She ran some basic blood work and examined my lymph nodes. She then ordered some ultrasounds of my neck to get a better picture of what was going on. Once the results of everything came in, aside from me being a little anemic and my lymph nodes being big, I had no other signs or symptoms that indicated anything serious was going on. So with that, I was sent home to do some watchful waiting. Essentially, don't worry about it unless something gets worse, like the lymph nodes start growing in size or becoming sore or tender. A year went by and I decided to go in for an annual physical. I had to see a new doctor this time since I had moved. I mentioned to him how I have these constantly swollen lymph nodes, but nothing has changed as far as I could tell. They're just always there. He ordered some more in-depth blood work and examined the lymph nodes in my neck. This time, upon examination, he could feel an enlarged lymph node on the back of my neck. However, in my chart, only the lymph nodes on the left side of my neck were noted as being enlarged. I hadn't noticed it, and since it wasn't noted in my chart, we didn't know if it was a sign of something worsening or if it was just missed in the past. Because of this, he referred me to a hematologist for further examination. At the hematologist, they did even more blood work, and they examined my lymph nodes. Thankfully, the examination revealed that while they were visibly enlarged, they didn't feel malignant. However, they wanted to be sure, so they ordered more imaging, and this time not just of my neck. I got ultrasounds of my neck and abdomen, as well as CT scans with contrast from the waist up. The imaging revealed that I have swollen lymph nodes everywhere in my body, not just my neck. Good news was, though, that there were no masses, tumors, or any other signs of malignancy found. Their final assessment was that the swollen lymph nodes are reactive, and for some reason I had a ton of inflammation in my body, but they didn't know why, and that maybe I should try improving my gut health. A few months goes by and I start getting random aches and pains. Sometimes the pains were sharp and sudden, other times dull but longer lasting. I kept trying to find reasons why I was getting these pains. I thought maybe it was from working out, or maybe I was injuring myself somehow. But I had no idea. The pain was so bad sometimes that I considered going back to the doctor in case I broke or tore something, but I couldn't think of a reason why that could have happened. So I waited it out, and eventually the pain would go away, and I'd think, oh, whatever it was must have healed. Another 3 or so months go by, and I was still getting random pains, but I didn't think anything of them. But now, on top of that, my skin was starting to really act up. I was starting to get these red splotches across my nose that wouldn't go away, and I was getting these rashes all over my legs, and then I started to get a rash on my scalp. Another month goes by, I start getting these sores in my mouth that wouldn't heal. I Googled it and decided I should probably see a doctor if these sores didn't heal on their own soon, because at that point I'd already had the sores for a few weeks and it only seemed to be getting worse. By the time I saw a doctor about it, I'd had the sore for about 2 months, and it still hadn't healed. I only mentioned the sores and none of the other things I was going through because I didn't think there was anything wrong. After we talked about the sores, he said I should see a dentist to get their thoughts and that this could be a symptom of an autoimmune condition, so he would like to order some more labs. A few weeks went by though, and no lab orders ever came through. I did go ahead and see my dentist, and he looked at my sores, and then he said he thought it could be likely I have something like a vitamin B12 deficiency, or I could have an autoimmune condition. Although my primary care doctor at the time was nice, I wasn't the happiest with the care that I was receiving. My pain was getting more frequent and more intense, my hair was starting to fall out, my skin was a nightmare, and I was exhausted all of the time. I described myself as feeling like an arthritic old lady. Luckily, I had the opportunity to switch doctors, so I went and saw a new primary care doctor. I told them about how my hands and wrists frequently hurt, and I showed them rashes on my arms and legs. I talked about the sores in my mouth and how my last doctor mentioned he suspected an autoimmune condition but never ordered the labs, and my dentist also had mentioned the possibility of having an autoimmune condition. At the time, I was pretty convinced I had something like arthritis. That's just what it felt like to me. But my doctor suspected lupus. He ordered labs for inflammation markers and an ANA panel. The inflammation markers came back within normal ranges for me, but my ANA titers were positive at 1 to 1,280. With that, my doctor referred me to a rheumatologist. Here, again, I got very lucky that the closest rheumatologist to me had a cancellation the very next week, so I was able to see a rheumatologist super soon. In that short week and a half before I got to see them, though, I noticed a new symptom. My nails were starting to come up off the nail bed. It only happens to a few fingernails, but it definitely struck me as odd. At my first rheumatology appointment, I showed and told her everything I had told my primary care doctor. She reviewed my labs and asked me some additional questions, like if my fingers or toes ever turn white or blue, or if they sometimes go numb and tingly, which, yes, to both. And she agreed that it seemed very likely I had an autoimmune condition. They just had to narrow down which ones. So she ordered antibody tests to see which antibodies were present in my blood. She warned me that if I wasn't in the middle of a flare, it could be hard to get a conclusive result from the blood work. So I should have the labs done when I feel like I'm flaring. But luckily or unluckily for me, I had felt like I was flaring for the last 6 months, so I went ahead and got the labs done. Over the course of the next 2 weeks, the lab results slowly started trickling in. I ended up testing positive for 3 different autoantibodies. Anti-double-stranded DNA, which came back at over 300 units per milliliter, Smith RNP, which had a value of 144, and ENA-SSA-RO, which came back at 3.2. And with that, in November of 2024, I got an official diagnosis of systemic lupus erythematosus and Sjogrens syndrome. I was kind of blindsided by the Sjogrens diagnosis, but afterwards I remembered I had been complaining about it being hard for me to swallow for a while, and Sjogrens also causes swollen lymph nodes, so the diagnoses made sense and I was glad to have answers. I was immediately prescribed hydroxychloroquine, which goes by the brand name Plaquenil, to take once daily. Hydroxychloroquine is a very slow-building drug. It can take 3 to 6 months before it's at full efficacy, and that is a long time to wait. The first 2 months after diagnosis, my symptoms were getting worse. The pain was starting to become very debilitating. Before, it was just occasional pain in limited areas, but now something was always hurting to some degree. There were some days where I could hardly walk. There were many days where I couldn't use my hands well, so writing and drawing were much more difficult. And it's unpredictable. There's no telling what will be bothering me one day versus the next. I know that the treatment is doing something behind the scenes. Having just passed the 3-month mark of treatment, I think I'm starting to feel a little better. But I do still always have some kind of inflammation going on somewhere. It's just not been quite as intense recently. I don't know if things will continue to get better or if things are just calming down for a little like they used to, but will eventually ramp back up again. Being at the 3-month mark also means time for another rheumatology appointment, which also means I had to get my blood work done again. This time, my anti-double-stranded DNA value was 1 to 640, which is still a strong positive. The normal value for this is below 1 to 10. I don't know what I expected it to be, but it feels like it's still being high confirms that I'm not just being a dramatic little baby when I say I'm in pain. My rheumatologist and I decided to give this treatment another 3 months since it takes 3 to 6 months, and I've recently started to feel a little better, so maybe that'll continue. If not, we'll try a different treatment option, but for now, more waiting. Thank you all so much for watching. I hope you enjoyed this video. If you have any questions, leave me a comment down below. Thanks again for watching, and until next time, goodbye.